Cervical cancer is the second most common cancer in the Philippines among women, second to breast cancer. It is mainly caused by the human papillomavirus infection, or what we commonly say as HPV. Every year, we have 8,000 diagnosed cases, and every day, 11 women are dying of cervical cancer. Most of our cases are diagnosed in the late stage, which leads to the very high mortality rate. The key to a successful cervical cancer control program is manifold. First, prevention through vaccination, widespread screening, and treatment. So primary prevention will be through behavior modification and vaccination. Our Department of Health has a community-based national immunization program. Second, a widespread screening program. We still do not have a nationwide systematized screening program. We have been using the pap smear for decades. The visual inspection for acetic acid have decreased maternal mortality, but recent studies have proven and shown that the HPV test is the most accurate and is the one that is recommended, especially for low-resource settings. We need the most accurate test at the longest possible interval. HPV testing is done every 5 years compared to cytology, which is every 3 years. And this is the reason why the US FDA in 2014 have already decreed that HPV tests should be the first screening test that we do. We are happy that in Chong Hospital, we do have the HPV test. Lastly, early intervention and access to appropriate treatment will lead to the best patient outcome and even the possibility of cure. At Chong Hospital, we have the medical expertise with a lot of gynecologic oncologists on board, and they are ably supplemented by our radiation oncology services and our chemotherapy services. Today, the World Health Organization has a global strategy setting 3 targets by 2030 to eliminate cervical cancer. First, 90% of girls by the age of 15 should have received the HPV vaccine. 70% of women should have been tested with a high-quality HPV test between age 35 to 45. And lastly, 90% of women with cervical problems will have access to treatment. Go and have yourself vaccinated. Have your HPV testing. We are looking forward to a cervical cancer-free Cebu.